Good morning. I'm Howard Lux. This is your Orthopedic Minute. This will be a very brief minute. I wanted to introduce a simple potential new hashtag. There are a lot of those out there on Twitter who despise hashtags. There are a lot of those you on Twitter who love utilizing hashtags. It allows us to follow certain streams, follow certain information, follow certain people. It can be enabling, and yet it can be quite distracting at the same time. There are those who will accuse me of contributing to the death by hashtag nature that many subscribe to. However, here we go. There are many hashtags that exist on Twitter which enable those of us who are active on Twitter to follow a certain topic. It's a way we tag our post, typically 4-6 letters preceded by a number sign, and we can search those on Twitter. Now, there's a hashtag that's very popular, and that's hcsm or hcsm, healthcare and social media, health communications and social media, etc. However, it's become quite a silo, a very active silo. But what do we do with it? We talk a lot, we explore a lot of different ideas, but there's very little tactical, real-world applications that develop from that. While that discussion is important because it's obviously growing by leaps and bounds, if you've ever been on the hcsm Twitter chat on Sunday night run by Dana Lewis, you know it's like drinking from a fire hose. It's a very active board. However, there are a lot of lurkers and physicians and healthcare providers who are either in the background or just starting to become active, and they're not really sure what to do with the information they're gleaning from this hashtag or Twitter talk. Therein lies my new concept, thcsm, where the T stands for tactical. We need tactical guidance. I'm getting tired of going to meetings and learning about all these wonderful new endeavors and innovations that either a company or a platform is considering, or even the government and the Center for Medicaid and Medicare and their Center for Innovation are considering, only to have the conference end with no tactical session, no breakout sessions, no meeting with experts to discuss what the next steps are. My thoughts with the tactical hcsm or thcsm hashtag is simply this. Let's not necessarily utilize it as a chat. Let's utilize it as a means of tagging activities that we find to be very useful. These are real-world activities. These are best practices which show how either industry leaders, our healthcare institutional leaders, such as the Mayo Clinic and Ed Bennett and his organization, or the Healthcare hashtag Twitter project run by Foxy Practice, and physicians such as myself and at Seattle Mama Doc or Wendy Sue Swanson are actually doing. Then we'll be able to provide these lurkers or followers with a potential area to explore and to learn how they can actually enter this space with a little more confidence and a lot less fear. So think about utilizing the thcsm or tactical healthcare social media hashtag when you arrive on one of these sites. I hope it'll go a long way into getting far more people active in this space. You guys have a great day out there. Take care. Bye.